Welcome to Excellent Grades Academy. This is Dr. Byson EM. So today we're looking at histology and we're looking at ossification, bone ossification, and bone repair. Okay, so now what is bone? Bone is a specialized connective tissue. So let me just write it here. So bone is a specialized connective tissue. So connective tissue. Now, it being a connective tissue, it means that it contains cells and extracellular matrix. So in this video, we're going to look at the cells of bone and what makes up the extracellular matrix of bone. Bone being a specialized connective tissue, the extracellular matrix is a bit more specialized, or it has got extra components. We know that extracellular matrix is made up of protein fibers, number one, and it's made up of ground substance. So there are specific things that are added to the ground substance, like calcium dihydroxyapatite, which is crystallized calcium in bone. That's what makes it specialized. Okay, let's get into this. Now, what are the functions of bone? Number one, protection for vital structures. Protection of vital structures like the brain. The brain is found in a cavity formed by bones in the calvaria. Number two, support for the body, for you to stand and to move. It's the brain, the bones that serve that function. Number three, as a site for muscle attachment, which provides mechanical basis for movement. So muscles are attached to bones using tendons, and when muscles contract and relax, there is movement of the skeleton. Number four, for hemopoiesis, which is production of blood cells in the bone marrow. Production of red blood cells, which is erythropoiesis. Production of white blood cells, which is leukopoiesis. And production of platelets, which is called thrombopoiesis. All right. Number five, and not the least, mineral storage. Bone stores calcium. This is very important. So bone stores calcium. Calcium is a very important mineral that is stored in the bone. Besides calcium, there is storage of phosphorus and magnesium. Okay, let's go on. Now, let us look at the type of cells that are found in the bone tissue. So the bone is a specialized connective tissue composed of calcified extracellular bone matrix and three major cells. These major cells are the osteoblasts. Now, the function of the osteoblast is that they synthesize the organic components of the matrix in a process called ossification. So, for you to ossify bone, for you to have bone, there are cells that are produced known as the osteoblasts. Number two, osteocytes. So the osteocytes are derived from the osteoblasts. And after osteoid matrix formation, matrix formation is formed by the osteoblasts. So after the osteoblasts form the osteoid matrix, they mature into osteocytes. So you can say the osteocytes are mature osteoblasts that are found in very small spaces within the bone matrix called lacunae. So lacunae, called lacunae, between the bone matrix layers. Now, the cytoplasmic processes extend into small canaliculi. So we're going to see this in a 3D diagram very soon. So the osteocytes have processes which extend from the cytoplasm, and these processes are not found in the canaliculi, but they are found in very small spaces called canaliculi. Canaliculi. Let me just highlight it so that you see. Canaliculi. So these are small spaces where the cytoplasmic processes of osteoblasts are found. And these are found between lamellae. Lamellae, by definition, are simply concentric collagen type 1 rings that are formed in the lamellar bone. The third type of bone cells in the bone is the osteoclasts. So the osteoclasts are multinucleated. They are multinucleated, meaning that they've got multiple nucleus, and they are giant cells that are involved in the resorption and remodeling of the bone. Resorption is where you damage bone or you destroy bone so that you can release minerals like calcium and phosphorus and magnesium into the bloodstream. Remodeling is where you break down bone so that you can maintain the architecture of bone. So the proper architecture of bone involves remodeling and formation. So the structure of the bone that we see is as a result of bone formation by the osteoblasts and bone remodeling by the osteoclasts. Okay. So now let's look at these bone cells in detail. So the osteoblasts are responsible for the synthesis of the organic components of the bone matrix. Organic component of the bone matrix. What we should know is that the bone matrix has got the organic components plus the inorganic components. So the bone matrix is made up of the organic plus the inorganic components. Now, the organic components of the bone matrix are synthesized by the osteoblasts. So there are three constituents of the organic components of the bone matrix, which are produced by the osteoblasts, which are type 1 collagen, proteoglycans, and glycoproteins. Now, deposition of the inorganic components of bone also depends on the presence of viable osteoblasts. What this means is that for the inorganic components to be deposited into the bone, it depends on the presence of osteoblasts. Why? Because osteoblasts are able to synthesize a protein known as osteocalcin. This osteocalcin is going to trap calcium in the bone matrix. Osteoblasts are exclusively located at the surfaces of bone tissue. So they're not located at the center of bone tissue, but they are located in the peripheries of the bone, side by side. So they line the outer part of the bone side by side in a way that simple epithelium does. We know that epithelium lies on a basement membrane in a line. That's how osteoblasts are lined up on the surfaces of bone tissue. So when they are actively engaged in matrix synthesis, osteoblasts have a cuboidal. Look at this. They have a cuboidal to columnar shape. This is important. When they are actively engaged in the synthesis of bone matrix, they have a cuboidal to columnar shape and a basophilic cytoplasm. So meaning that they will stain blue when you use H and E, blue or purple. So when their synthesizing activity declines, they flatten and cytoplasmic basophilia declines. So when osteoblasts become less active, they flatten and they mature into osteocytes. They mature into osteocytes. Okay. So let's move on. So now this is a structure that is depicting a bone matrix. So you can see on the periphery here, this side here, these cells that are lined like epithelia, they have a cuboidal cell. You can see that. Okay. These are osteoblasts. So these are osteoblasts. And then This giant, let me use another color so that we can appreciate. This giant cell here, you've seen this giant cell here, that has got multiple nucleus. It has 1 nucleus, 2, 3, 4, 5. This one here is an osteoclast. Osteoclast. And then the cells that are found in the bone matrix inside the spaces. So there's a space here. And inside of the space, we can see this cell here that is flat. These are osteocytes. Osteocyte. So osteocytes are formed from osteoblasts. When they lose their synthetic abilities, they lose their cuboidal cells, they become flat, and they go and settle in the lacunae. So this space where the osteocyte is what we call the lacuna. It's like a nest for the osteocyte. It's a nest. So it's a nest for the osteocyte. And then this is the bone matrix here. Bone matrix. Now you may ask, what are these cells here? Okay, so this is just connective tissue cells. These are mesenchymal cells. These are mesenchymal cells that could differentiate into anything. They could be fibroblasts or differentiate into anything. Now, between the bone matrix and the layer of osteoblasts, you can see this newly formed bone matrix here that appears whiter than the actual bone matrix. This appears whiter than the actual bone matrix because it is not yet calcified. And newly synthesized bone matrix that is not yet calcified is what we call osteoid. So this is osteoid. Let me label it from the inside. This is osteoid. Osteoid is deposited on the peripheral sides of the bone so that the bone can grow in width or in diameter. The growth of bones in diameter is what we call appositional growth. All right, I hope I got the spelling down. Appositional growth. So where bone matrix is deposited in the peripheries of bone, osteoid is deposited in the sides of the bone between the osteoblasts and the bone matrix so that the bone can grow in diameter. That is what we call appositional growth. Okay, so I wrote ground here. It's supposed to be growth. Appositional growth. On the left side here, this is a histological diagram. So this histological diagram, let me use something that is going to be visible on this. This histological diagram, this layer of cells that you see here, those are the osteoblasts. So these are the osteoblasts here. Osteoblast. And then underneath the osteoblasts, you can see this layer here that is a little bit pale compared to the bone matrix. So this is the bone matrix. And then this layer here is what we call osteoid. You can see this is a lacuna. Inside of a lacuna, there is a cell. So the inside of the cell there, this is an osteocyte. Osteocyte. And then this here is a giant cell that is multinucleated. So this is the osteoclast. All right. So let's move on. So osteoblasts are gradually surrounded by newly formed matrix and become osteocytes. During this process, a space called the lacuna is formed. So the lacuna are occupied by osteocytes, and then there are extensions, which are their cytoplasmic processes, with a very small amount of extracellular non-calcified matrix. So matrix components are secreted at the cell surface, which is in contact with older bone. This produces a layer of new bone, which we've already talked about, which is osteoid. Osteoid is bone matrix that is unmineralized, meaning it doesn't have calcium. This process is what we call bone apposition. That is called appositional growth. All right. Okay. Now let's look at osteocytes. Osteocytes are derived from osteoblasts. They lie in the lacunae situated between the lamella of the matrix. Only one osteocyte is found in each lacunae. So the thin cylindrical matrix canaliculi house cytoplasmic processes of osteocytes. Processes of adjacent cells make contact via gap junctions. So what that means is that when this is an osteocyte and this is an osteocyte here, this osteocyte is going to give a cytoplasmic process which will lie in a canaliculi, and also this one will give a cytoplasmic process which will lie in a canaliculi. These two communicate via gap junctions. So there is communication between two osteocytes via their cytoplasmic processes, and the processes communicate via small junctions between them, which are known as gap junctions. So this is the osteocyte here, osteocyte giving the cytoplasmic processes. These cytoplasmic processes lie in a canaliculi and they communicate via gap junctions. Everyone should know this. This is very important. So the gap junctions pass molecules from cell to cell. So these cells are actively involved in the maintenance of the bone matrix. The maintenance of the bone matrix is carried out by osteocytes. And the death of osteocytes will lead into resorption of the bone matrix by the osteoclasts. Okay. So hence, osteocytes are involved in the maintenance of homeostasis of calcium and phosphates between the bone matrix and the blood. Now let's go to osteoclasts. These are very large, number one, multinucleated, branched motile cells found along bone surfaces where resorption, remodeling, and repair of bone takes place. So dilated portions of the cell body contains about 5 to 50 nuclei. When an osteocyte dies, the surrounding bone matrix is resorbed by the osteoclasts. So we've already talked about this. Now, in areas of bone undergoing resorption, in areas of the bone where there is ongoing resorption, osteoclasts will lie on the resolved surfaces or within enzymatically corroded shallow depressions of the bone known as house shapes canaliculi or house shapes lacunae. So where on the bone there is resorption going on, that shallow depression where the osteoclast will lie is what we call the house shapes lacunae. Osteoclasts are derived from the fusion of bone marrow derived mononucleated cells. First, osteoclasts are the macrophages of bone tissue. Remember, when macrophages go to different tissues, they assume different names. So macrophages in the bone are known as osteoclasts. They're known as osteoclasts. So remember this, because it's very important. Thus, they do not belong to the osteogenital cell line, but to the hematopoietic progenitor cells called the mononuclear macrophage monocyte cell line of the bone. Now, in active osteoclasts, the surface facing the bone is what we call the ruffled border. It's called the ruffled border. And then surrounding the ruffled border is a cytoplasmic zone that is called the clear zone that is devoid of organelles yet rich in actin filaments. This zone, which is a clear zone, is a site of adhesion of the osteoclast to the bone matrix. and creates a microenvironment between the cell and the matrix in which the bone resorption occurs. What we're talking about here is this. Let me show you. Is this. Have you seen? This here is the osteoclast. And then this here is the bone matrix. That's the bone matrix. Now, where the osteoclast and the bone matrix are connecting, this is what we call the ruffled border. Okay, this is the ruffled border here, the one that I'm tracing through. So the ruffled border, and an area where they are actin filaments. These are actin filaments. These are helping the osteoclasts. This zone here is the clear zone. They're helping the osteoclasts to adhere to the bone matrix or to attach to the bone matrix. Okay. So now for the osteoclasts to resolve bone, for it to resolve bone, let me show you the entire picture. So for it to resolve bone, you need to produce lysosomes. So these lysosomes will go to the bone, to the ruffled border, and then they'll activate an enzyme called collagenase, and the collagenase is going to digest the collagen type 1 that is found on the bone. And that's how the bone is resolved. That's how the osteoclasts carry out their functions. Okay. So the osteoclasts, we've already talked about, secretes collagenase and other enzymes and pumps proteins into the subcellular pocket, promoting the localized digestion of collagen and dissolving calcium salts. Osteoclast activity is controlled by hormones and cytokines. Osteoclasts have receptors for calcitonin, a thyroid hormone, but not for parathyroid hormone. So the osteoblasts are the ones that have got a receptor for parathyroid hormone. When activated by this hormone, when the osteoblasts are activated by parathyroid hormone, they produce a cytokine that is called the osteoclast stimulating factor. They produce the osteoclast stimulating factor. The osteoclast stimulating factor will then stimulate the osteoclast for the process of bone resorption. So that's how bone resorption happens. Parathyroid hormone is going to stimulate the osteoblasts. The osteoblasts are going to produce what we call the osteoclast stimulating factor, which are going to stimulate the osteoclasts for the process of bone resorption. So when you are asked which hormone promotes bone resorption, it is the parathyroid hormone, which is produced by the parathyroid glands. So now let's look at the differences between PTH and calcitonin in bone homeostasis, in calcium homeostasis. This is very important for you to know. Very, very important for you to know. So, PTH is secreted by the parathyroid hormones. Calcitonin is secreted by the parafollicular cells of the thyroid glands. So, it is released when there is hypocalcemia to increase serum calcium level to normal by promoting bone resorption and calcium reabsorption in the nephrons of the kidneys. So these are the two processes by which calcium in the body is increased. When you have got low levels of calcium in the body, that's called hypocalcemia. Now, to increase the calcium levels in the body, PTH is released and it will activate the osteoclasts to resolve bone. However, calcitonin is released when there is high levels of calcium in the body, that is called hypercalcemia. so that it decreases serum calcium to normal level by promoting bone formation and excretion of calcium by the kidneys. Thus, it inhibits bone resorption. So calcitonin inhibits bone resorption. Parathyroid hormone, PTH, stimulates bone resorption. That's the difference. Now, let's look at the inorganic components of the bone. So the inorganic material represents about 50% of the dry weight of the bone. The most abundant component of the inorganic part of the bone is calcium hydroxyapatite. Okay, it's the most abundant, but it also contains bicarbonate, citrate, magnesium, potassium, and sodium ions. Now, calcium hydroxyapatite is a crystallized form of calcium, together with phosphate and hydroxy ions. All right. Now, what you need to know is that the surface ions of hydroxyapatite crystals are hydrated, meaning that in the inorganic component there is also water. The layer of water around the crystals facilitates the exchange of ions between the mineral and the body fluids. The organic component, as we've already earlier discussed, contains type 1 collagen, glycoproteins, and proteoglycans. Okay, there are specific glycoproteins in the organic component of the bone, which is called osteonectin. Calcium binding glycoproteins such as osteocalcin and the phosphates released in the matrix vesicles by osteoblasts promote calcification of the matrix. So what you need to know is that without osteoblasts, there can't be calcification of the matrix. It's impossible. Okay. So the association of the minerals, which is the calcium hydroxyapatite, which contains calcium and phosphates and hydroxy ions, with the collagen fibers during calcification is responsible for the hardness and resistance of bone. Now, after the bone is decalcified, its shape is preserved, but it becomes as flexible as a tendon, because the bone and the tendon have got the same type of collagen, which is collagen type 1. Okay, so those were the cells of the bones. Let's look at the periosteum and the endosteum. The periosteum and the endosteum are external and internal surfaces of bone. Okay, so the periosteum is organized much like the perichondrium. The perichondrium is the outer connective tissue layer of cartilage. The periosteum is the outer layer of bone, and it has two layers. It has the outer fibrous layer and the inner osteogenic cellular layer. The outer layer is dense connective tissue with very small blood vessels, collagen fibers, and fibroblasts. So because it has blood vessels, it will supply the bone with nutrients and oxygen and take away carbon dioxide. This is the picture here. Okay. So as you can see here, from here to here, that is the periosteum. So the periosteum layer here has got the fibrous layer, the outer one, from here to here, and then it has the cellular layer, which has got cells from here to here. So it's a layer, the outer one and the inner one. So this is the inner one here, and then this is the outer one. All right, so this is the periosteum. The endosteum, however, has got these cells here. All right, these cells that are lined in the same layer with the osteoclasts and the osteoblasts. So we're going to look at those cells as we go on. So the periosteum has got bundles of periosteocollagen fibers called perforating fibers of Chappé, which penetrate the bone matrix, binding the periosteum to the bone. So What connects the periosteum to the bone are perforating fibers of Chappé. The inner region of the periosteum is a more cellular layer containing bone lining cells, osteoblasts, and mesenchymal stem cells called osteoprogenitor cells. The osteoprogenitor cells are these ones that we found here. So these are the osteoprogenitor cells. Let me just label them. So these are the osteoprogenitor cells. Osteoprogenitor cells. These osteoprogenitor cells are capable of synthesizing osteoblasts. And the osteoblast is the one that synthesizes the matrix of the bone. So the osteoprogenitor cells have got the potential to proliferate and differentiate into osteoblasts. These play a prominent role in bone growth and in bone repair. The principal functions of the periosteum: number 1, to nourish the osseous tissue. Number 2, to provide a continuous supply of new osteoblasts for appositional growth or repair. And we already discussed what appositional growth is. Let's move on and look at the endosteum. The endosteum is thinner than the periosteum, covers small trabeculae of bone matrix that project into the bone marrow cavities. It also contains osteoprogenitor cells, the osteoblasts, and bone lining cells. So those were the periosteum and the endosteum. Now let's look at the types of bone. We've got 2 types of bone, depending on gross observation. So classification of bone tissue. So classification of bone tissue is in 2. There is 1, the gross observation. Gross observation. Under gross observation, there are 2 types of bone. Number 1, which is called compact bone. Number 2 is trabecular bone or spongy bone. Number 2 classification is histological classification. So histological classification, logical classification, is based on what we see under the microscope. So there are 2 types of bone here. Number 1 is what we call lamellae bone, depending on the organization of collagen fibers. And number 2, we've got woven bone. So don't be confused when I start talking about the types of bone. So depending on the gross classification of bone, there are 2 types. We have compact bone, which is 80% of total bone mass is compact bone, located closer to the surface of the bone, has no interconnecting cavities. Number 2, we've got cancerous bone, which is also called trabecular bone or spongy bone. Has got 20% of total bone mass, located in the deeper areas of the bone, has numerous interconnecting bone. Now, in long bones, long bones are shaped like this. You've got a bulging at the end here, and then a shaft, and then a bulging at the other end like that. Okay. Now these bulges are what we call epiphyses. And then these middle ones, the shafts, are what we call diaphyses. Diaphyses. This is epiphysis. Between the epiphysis and the diaphysis here, you've got the metaphysis. Meta just means in between or change. Metaphysis. In the metaphysis, you find what we call an epiphyseal plate or growth plate or a growth zone. Okay. So in long bones, which are these bones here, the bulbous ends are called epiphyses. The ones that I've showed you there. They're the bulbous ends. They're elongated or enlarged ends. They are composed of spongy bone covered by a thin layer of compact bone. So the compact bone is found in the periphery outside. Let me use another color so that we appreciate. Okay, so just the thin layer outside there, this is compact bone, and most of the bone inside, let me use blue, most of the bone inside is spongy bone. So that is at the epiphyseal plates. That is at the at the epiphysis. That's the way bone is arranged. And then the diaphysis is mostly composed of compact bone. So most of the diaphysis is compact bone. It's going to be compact bone like that. So remember, we said compact bone is found in the peripheral sides of the bone. Most of it is compact bone. And then it has a thin region of spongy bone. So the spongy bone is just on the middle there, thin. So that's how long bones are arranged. So the diaphysis is almost totally composed of compact bone. As you can see, the one that is in red here is compact bone, and a thin region of spongy bone on the inner surface around the central marrow cavity. So where the marrow, the bone marrow is, it is in the spongy bone. Okay, so short bones such as scalpel bones or tarsal bones usually have large cores of spongy bone surrounded completely by compact bone. The flat bones of the skull have got 2 layers of compact bone called plates, separated by a thick layer of spongy bone called the dipro. Now let's look at the types of bone on microscopic examination. So histological examination of bone, there are 2 types of bones. We've got lamellar bone and woven bone. So the first classification was gross. Under gross, we had compact bone and spongy bone. Under microscopic examination, we've got lamellar bone and woven bone. In lamellar bone, the collagen fibers, so here collagen fibers are arranged in concentric rings. Concentric rings called lamellae. So called lamella. They are arranged in systems that are called Havesian canals. So Havesian systems. The Havesian systems are also called ostions. But in woven bones, the collagen fibers are just randomly arranged. Randomly arranged. That's where the difference is. Let's dig deeper into these 2 types of bones. So the lamellar bone is the most bone in adults. Compact or cancellous is organized as lamellar bone. So when you look at compact bone, which is also called cancellous bone, histologically it is organized as lamellar bone. Okay. So this is characterized by multiple layers of lamellae of calcified matrix. The lamellae are organized either parallel to each other or concentrically around the central canal. What I was talking about, where you have the central canal. Central canal has got blood vessels and nerves, and then around the central canal you've concentric rings of collagen type 1 fibers like that. Okay, that's how it is arranged. And then in these lamellae you're going to find lacunae that contains osteocytes like that. Okay, like that. That's how lamellar bone is organized. So each lamellae has got collagen type 1 fibers are aligned in parallel with the pitch of the fibers orientation shifted orthogonally in successful lamellae. So lamellar bone is highly ordered. Okay, there is an ordered organization of collagen within lamellar bone and is visible under the microscope. All right, so let's look at the system where the lamellae are organized in concentric rings, where the collagen fibers are arranged in concentric rings around a central canal, is what we call the Havazian system. Okay, the Havazian system. So this is what we're talking about. Before we look at the Havazian system, the outer boundary of each osteon is a more collagen-rich layer, which is called the cement line. So this is spongy bone here. Rather, this is compact bone. And in the compact bone, you can see that there's a central canal here. Around the central canal, you've got these collagen fibers that are forming rings like that. And then this organization is what we call an osteon, or a Havazian system. So there are a lot of Havazian systems in the compact bone. What connects the central canals of one Havazian system to another one is a canal that we call the Volkmann's canal. Okay, let us look at it. It is called the Volkmann's canal. This one here. Okay. Volkmann's canal. So the Volkmann's canal will connect two central canals of the osteons, or they will connect the central canal of the osteons to the periosteal layer, or to the bone marrow cavity. That is the function of the Volkmann's canal. Okay, so that is how it is arranged. This picture here is showing you the same thing. So this is the central canal here, which is also known as the Havazian canal, and then these are collagen fibers. Okay, collagen fibers, and in the collagen fibers you find these are osteocytes. The osteocytes have got cytoplasmic processes here. So you've seen the cytoplasmic process of this osteocyte is forming gap junctions with the cytoplasmic processes of this osteocyte. We said that the cytoplasmic processes of the osteocytes are found in very small spaces that are called canaliculi. The outer layer of a Havazian system is what we call the cement line. It has got more rich collagen. Okay. So this diagram here is just showing you the osteocyte. So this here is the osteocyte. This osteocyte has got these cytoplasmic processes. Okay, so cytoplasmic processes. The cytoplasmic processes are meeting together. This is what we call the gap junctions. So gap junctions. That is very important for you to know and to appreciate. All right, so this is what we've been talking about. And then that just shows you the osteon and the Havazian system. To recap, this here is the central canal. Around the central canal, you can see collagen fibers forming rings. Collagen fibers forming rings. And the rings that are formed have got these ones here, which are the osteocytes. The osteocytes are forming what you see here. These lines, those are cytoplasmic processes of osteocytes that are communicating through gap junctions. Okay. So each osteon is a long, sometimes bifurcated cylindrical, generally parallel to the long axis of the diaphysis. It consists of a central canal surrounded by 4 to 10 concentric lamellae. The central canal communicates with the marrow cavity and the periosteum and with one another through the transverse perforating canals, which are also known as the Volkmann's canal. The transverse canal have few concentric lamellae. Woven bone is usually more immature than lamellar bone. is a non-lamellar and is characterized by a random or irregular deposition of collagen type 1 fibers. Woven bone is the first bone tissue to appear in embryonic development and in fracture repair. It is usually temporal and is replaced in adults by lamellar bone, except in a very few places in the body. For example, near the sutures of the calvaria, where the bones of the skull are meeting. Those are the sutures. And in the insertions of some tendons. So where the tendons are inserting on the bone, that's where you find woven bone. It has a very low mineral content and is easily more penetrated by the X-rays. Often has a higher proportion of osteocytes than mature lamellae. These features reflect the fact that woven bone forms more quickly but has less strength compared to lamellae. Alright, let's move on to the next component, which is osteogenesis. Osteogenesis is simply bone development, and it occurs by one of two processes. Number one is called intramembranous ossification. Number two is called endochondral ossification. Intermembranous ossification, intramembranous. Intra means inside. Membranous just means connective tissue. Okay? The membranes. So this is where bone is formed from inside of connective tissue. What happens is that the osteoblasts would differentiate directly from the mesenchyme. Mesenchyme is connective tissue that is found in infants in the embryonic life. Okay, so osteoblasts differentiate directly from the mesenchyme, and when the osteoblasts are formed from mesenchymal cells, they begin to secrete osteoid, which is non-calcified bone matrix. This non-calcified bone matrix, the osteoid, will now be calcified and it will become bone matrix. The primary center where this starts happening is what we call primary ossification centers. That is the first site where bone formation in the membranes is started. Endochondral ossification is bone formation from hyaline cartilage. Okay, so the chondrocytes are invaded by osteoblasts and then they begin osteoid production. Let's look at this in detail. Look at this in detail. So the names refer to the mechanisms by which bone forms initially. That is what we call osteogenesis. So in both processes, the bone tissue that appears first is temporary woven bone. Remember, we said woven bone is immature bone. So both in intramembranous ossification and in endochondral ossification, the first type of bone that is formed is woven bone. This is soon replaced by stronger lamellar bone. During growth of all bones, areas of woven bone, areas of bone resorption, and areas of lamellar bone all exist contiguous to one another. Intermembranous ossification forms most flat bones of the skull. Okay, it is called intramembranous because it takes place within the membranes of embryonic mesenchymal tissue. A quick recap: we know that in the embryo there are two types of tissues. There is mesenchymal embryonic connective tissue, which is the most abundant, and then you've got mucoid tissue that you find in the umbilical cord. So the clavicle, the frontal bone, the parietal bone, parts of the occipital bone, the temporal bone, the mandible, and the maxilla are produced initially by this method. So within the condensed layer of mesenchyme, the starting points for bone formation are called ossification centers. So this is what is happening here. This here is mesenchymal connective tissue. Mesenchymal tissue. What you see here, these are mesenchymal cells. Mesenchymal cells have got the ability to differentiate into any cell. So they will develop first into these cells, which are called blastemas. The blastemas will now produce these cells, which are known as the osteoblasts. The osteoblasts will now start secreting osteoid. The osteoid there's an I here, osteoid. The osteoid will now calcify, and it will form bone. That is what happens in intramembranous ossification. So the mesenchymal cells produce blastemas, which will differentiate into osteoblasts. Osteoblasts will form osteoid. Osteoid will calcify and form bone matrix. That is how bone is formed in intramembranous ossification. Endochondral ossification is formation of bone from cartilage. Okay, bone from cartilage. So fetal membrane cartilage calcifies, and then cartilage will proliferate, and then will form bone. It will form bone. That is what happens. Primary ossification centers in long bone. All long bones are formed by endochondral ossification. That's why in demonstrating endochondral ossification, we're using a long bone here. So primary ossification centers are found mostly in the diaphysis. And then after the diaphysis, you've got the metaphysis having their ossification centers as well. Secondary ossification centers. So as you can see here on number 3, primary ossification centers forms in the diaphysis, and then secondary ossification centers form in the epiphysis. And then when the epiphysis and the diaphysis ossify, there's a layer of cartilage that remains, that is called the epiphyseal plate. The epiphyseal plate is what we call the growth plate. So this bone will remain growing long because of the epiphyseal plate. When the epiphyseal plate fuses and becomes the epiphyseal line, then growth ceases to occur. Okay, so now let's look at the 5 zones of an epiphyseal plate, which is called the growth plate. So number 1, everyone is supposed to know this. There's the resting zone, or the zone of reserve cartilage, and then the cartilage is resting. After it is resting, it will start proliferating, which is known as the proliferation zone. After the cartilage proliferates, it is going to hypertrophy. After it hypertrophies, then it is going to be filled with calcium, and then bone will form in the ossification zone. Let's look at the diagram. So this is the diagram here. So this is resting cartilage here. So zone 1 is zone of resting cartilage. Then the cartilage will start undergoing mitosis, and it will start becoming many. So it will start proliferating. So this is called the zone of proliferation. You've seen what is happening here. It was resting, but now it starts proliferating. Now, after the cartilage proliferates, it is going to start becoming big. So this is called the zone of proliferation, the zone of hypertrophy rather. So the cartilage will start becoming big. So zone of hypertrophy here, of hypertrophy. After the zone, the cartilage hypertrophies, it will now be calcified. So the cartilage will be filled with calcium. It will be filled with calcium because of the presence of the bone cells, the osteoblasts. So zone of calcified cartilage, which is here. And then zone of ossification. Ossification happens. When the cartilage is calcified, it forms bone. This is zone of calcification. So you need to know these 5 zones, because they are very important. 5 zones of the growth plate, or the epiphyseal plate. It comes in exams. So zone 1, resting zone. Zone 2, zone of proliferating cartilage. Zone 3, zone of hypertrophic cartilage. Zone 4, zone of calcified cartilage. Zone 5, zone of ossification. Very important. This slide is showing the same thing. All right. So in summary, growth in length of a bone occurs by proliferation of chondrocytes in the epiphyseal plate. Chondrocytes are simply cells of cartilage. At the same time, chondrocytes in the diaphyseal side of the plate hypertrophy. The matrix becomes calcified and the cells die. Osteoblasts lay down a layer of new bone on the calcified cartilage matrix. Okay. So because of the rates of these two opposing events, proliferation and destruction are approximately equal. The epiphyseal plate does not change thickness. Instead, it is displaced away from the middle of the diaphysis, resulting in growth in the length of the bone. Alright, so this is where you find the epiphyseal plates in the fingers. Here, let me label it. So here, between these are metacarpal bones and the first pharyngeal, first phalanx here. And then in the long bones, so here, the long bones. So this is the radius here. This is the ulna at between the epiphysis and the diaphysis. That's where you find epiphyseal plate. So now let's look at the last part, which is bone growth, remodeling, and repair. Osteogenesis and bone growth involves the partial resorption of bone formed earlier, while simultaneously laying down new bone at a rate exceeding that of bone removal. The sum of osteoblast and osteoclast activities in a growing bone constitutes the process of bone remodeling, which maintains bone's general shape while increasing in mass. The rate of bone turnover is very active in young children, where it can be 200 times faster than that of adults. So in adults, the skeleton is renewed continuously in a process of bone remodeling. That also involves coordinated, spatially linked cellular activities of bone resorption and bone formation. The constant remodeling of bone ensures that, despite its hardness, this tissue remains plastic and capable of adapting its internal structure in the face of changing processes. Okay. Now, sometimes bone fractures are repaired by a developmental process involving fibrocartilage formation and osteogenic activity of the major bone cells. There are three phases in fracture healing. Number 1 is the reactive phase. Number 2 is the reparative phase. Number 3 is the remodeling phase. So the reactive phase, 1, fracture and inflammatory phase, where you fracture and then there is inflammation. And then there is granulation tissue formation. In the reparative phase, there is fibrocartilage callus formation. Number 4, there is lamellar bone deposition. And then in the remodeling phase, there is remodeling to original bone contour. Remodeling to the original bone shape. That's what contour means. Okay. So bone fractures disrupt blood vessels, causing bone cells near the break to die. The damaged blood vessels produce a localized hemorrhage or hematoma. That's what we call hematoma formation. When you fracture your bone, there's going to be a hematoma around the fracture because the blood vessels around that bone are damaged. So they're going to bleed into the fracture, forming a hematoma. Clotted blood is removed along with tissue debris by macrophages, and the matrix of damaged cell-free bone is resorbed by osteoclasts. The periosteum and the endosteum at the fracture site respond with intense proliferation and produce a soft callus. So after hematoma formation, there is soft callus formation of fibrocartilage-like tissue that surrounds the fracture and covers the extremities of bone fracture. The fibrocartilaginous callus is gradually replaced in a process that resembles a combination of endochondral and intermembranous ossification. This produces a hard callus. So the process goes like this: hematoma formation. After a fracture, there is hematoma formation. After hematoma formation, soft callus formation. which includes formation of a fibrocartilage-like structure. And then after that, there is hard callus formation. A hard callus formation of woven bone around the fractured ends of the bone. Stresses imposed on the bone during repair and during the patient's gradual return to activity serve to remodel the bone callus. The immature bone of the callus is gradually resolved and replaced by lamellar bone, remodeling and restoring the original bone structure. So this is what happens. If you fracture your bone, number one, there is hematoma formation. After hematoma formation, this is just blood vessels bleeding into the fracture, because when you fracture your bone, blood vessels are severed. So there is hematoma formation. After hematoma formation, there is fibrocartilage, soft callus formation. Fibrocartilage forms. And then fibrocartilage is replaced by woven bone in a hard callus formation. This hard callus formation is now replaced by lamellar bone. Okay, so that's what happens. Same thing that is happening here. So for the osteoproliferation, callus formation, hyaline cartilage, and fibrocartilage, and then this is replaced by secondary bone. Medical application and the conditions of bone: there is osteoporosis, osteopetrosis, osteomalacia, rickets, acromegaly, giantism, pituitary dwarfism, osteogenesis imperfecta, osteostitis fibrosa cystica, which is OFC, bone tumors such as an osteosarcoma, osteoma, and osteomyelitis. Okay, so this was bone ossification and repair. It was a very long lecture. You're going to find a lot of value in this lecture, and then all the best on your assessment on this topic. See you in the next class.